Good morning, ladies and gentlemen, and thank you for having me at the ICON 2024 conference. It's an honor to speak with you today. The topic of my discussion today will be strategies to encourage networking and collaboration among participants with a shared interest in patient-centered care. My name is Dr. Tayaba Khan. I begin this discussion with this illustration of a pit stop that is a usual sight at Grand Prix races. As of today, the world record for the fastest pit stop is at 1.80 seconds, which was made by the McLaren Racing Limited pit crew servicing Lando Norris. This happened during lap 27 of the 2023 Qatar Grand Prix. This is a fantastic imagery illustrating the magical achievement of a team when it works in alignment with each other in a trust-based environment. Now, imagine that instead of the car, there is a patient, and instead of the pit crew, there is a crew of the care team. I'm hoping this illustrates the powerful impact of a coordinated team effort in creating patient-centered care and the phenomenal impact on the trajectory of a patient's health journey it can achieve. Our world of healthcare delivery is now evolving due to a myriad of factors. As the rates of chronic diseases rise, the need for complex interprofessional care is increasing. The patient now needs the physicians to work together more than ever. Though the value of interprofessional collaboration and networking is well received and appreciated, sadly, implementation is altogether a different challenge. Added to these factors is the fact that healthcare teams, like so many teams from other industries, are becoming more diverse, more specialized, and in some cases, geographically dispersed. Patients now are becoming active participants and contributors in medical research and care pathway discussions. This means that they demand and expect care that is ethical and quality-centric, advanced, and integrated. To achieve this, here are some proposed key points and insights that I feel can help create the successful Grand Prix-style team culture in healthcare that truly brings care home for the patients. It's not surprising that the role of the leadership is at the center of this change. Like Formula One racing, a team's collaboration is dependent on the philosophy adopted by the top brass in the organization. Leaders and executives have to have interest and invest time and effort in supporting social relationships that exhibit and foster collaborative behavior in order to inspire others to follow. This could be achieved through regular employee interaction to gain trust. Grattan and Erickson in their publication provided some deep insights on what makes teams successful. And one thing they state is that the most productive, innovative teams were led by people who were both task and relationship oriented. What's more is that these leaders changed their style during the project. This is especially true in complex and advanced teams such as healthcare, as a good relationship-oriented leadership paired with a strong process-oriented skill level will help create the necessary trust, goodwill, skill, and expertise it so needs. The same approach would provide room to obtain feedback, which would allow for progressive quality improvement iterations. But leadership does not only need to engage the employees, it also needs to create environments that foster intended outcomes and overcome barriers to it. As Allah et al. In their study note, best teams develop a social tribe centered around their signature practices, which are derived from shared ethics and principles. And perhaps one idea here would be to create actual physical spaces that bring the team in one room and out of the oasis of individual departments. In military terms, a neutral ground may create that space to encourage dialogue and discussion. Which brings to another phenomenon seen in highly skilled teams. Grattan and Erickson also report that the greater the proportion of experts a team has, the more likely it will disintegrate into non-productive conflict or stalemate. This means that for executive leadership to obtain these results, they need to exhibit these behaviors so that other employees can emulate. The idea of open interactive spaces may just be the thing needed to obtain this interaction, and if these spaces are exceptionally well developed, foster learning opportunities. Employees in these circles can offer insights as to how patients perceived or experienced their care, which would help identify communication and coordination strategies accordingly. And this is where the experts come in. While the leadership exhibits these values and creates spaces for patient-centric care, the experts orchestrate the perfect symphony for delivering that care. Here a question is, however, that should specificity give way to creativity? Which is more important to promoting collaboration? A clearly defined approach towards achieving the goal, or clearly specified roles for individual team members? A common assumption is that carefully spelling out the approach is essential, but leaving the roles of individuals within the team vague will encourage people to share ideas and contribute in multiple dimensions. This also means that at least some portion of these experts should come from within. When teams are created with a combination of members that know and trust one another, it helps provide the framework for trust and basis to evolve the network. This in turn improves collaboration and shortens the time it takes for teams to identify their roles. The team can be better utilized to create innovative solutions for the patients. But then how do you bring people up from within? That is where mentoring comes in. Healthcare industry, unfortunately, is one of its kind in having a tit-for-tat culture, forcing professionals to work in silos and creating environments where people are reticent to work together. What remains unrealized is that patient-centered interprofessional collaboration are not aspects that can be taught theoretically, but rather are learned by integration within the team. Therefore, to enable this, there is a need to create a strong mentoring and coaching culture around the behaviors the organization aims to manifest, which can be achieved through training, communication, and work processes. But then, no one wants to do anything that goes unrecognized. Enter human resources. Human resources is perfectly positioned to provide support to this effort by creating a reward system that encourages collaboration and innovation in patient care. This can be based on patient feedback and experience when receiving multidisciplinary care from the healthcare team. In this process, the organization can identify the pros in the organization and engage them to train and mentor others, thereby building a community and supporting the executive role. To conclude, some ways to overcome barriers to achieve interprofessional networking and collaboration opportunities around patient-centered care are enhancing organization-wide processes and procedures in favor of patient-centered care, being creative with space design, allowing open spaces for open discussions, cultivating staff collaborations through training and mentoring, and addressing patient care issues such as access, customer service, and patient education as part of care delivery. I will end my talk by emphasizing that culture is a key determinant of successful integration of patient-centered care, which needs support and exhibition by the leadership and which envelopes strong patient engagement. These, I believe, are key elements that make interdisciplinary collaboration and networking successful. And with that, I thank you for your time and attention.